All right. Welcome back. Thank you all for joining our second health insurance town hall. My name is Zach Goss again, for those of you who are just joining us, and we're excited to put on this town hall series to discuss some health insurance options available to you through the state of Vermont. So my role here at the Department of Vermont Health Access is to work within the enrollment and eligibility unit to communicate to the public and various stakeholders the best ways to access different health insurance options through the state. I also work with the in-person assister program, also working remotely now to help Vermonters if they need a more personalized approach or help to their health insurance needs, to maintaining or enrolling in health insurance. I'm joined today by Sean Sheehan, who is a health policy analyst at the Department of Vermont Health Access, senior policy analyst at Vermont Health Access. And also we have representatives from our various insurance carriers with us today to provide a brief introduction and also be available to help answer some questions you might have about things specific to their plans. So what I'm thinking we can do is go ahead and introduce our guests who are going to be here today. Maybe Sean, you can start and just kind of say a little bit about what's going on with the American Rescue Plan Act and our Health Insurance Town Hall. Then we'll go into our carrier introduction and do a brief introduction. And I'm thinking, because people may trickle in, I may shift things a little bit and have our carriers do their kind of brief description of their plan options, et cetera, after Sean kind of gives an overview of the American Rescue Plan and does his introduction. And then we will go into questions and comments from the public. I see we've got one question that's been posted already. So we will get to that, and we really encourage you to post your questions in the Q&A box in the live event. For those of you who are new to the Microsoft Teams live event, there is a Q&A window, and while you cannot unmute your microphone, you can post your questions to that Q&A window. And our goal is to answer all of those questions during our hour-long town hall today. They can be for us at the Department of Vermont Health Access, or they can be for one of our carrier representatives. And again, we will try and answer them best we can as we go today. So Sean, I'm going to turn it over to you just to do a quick introduction and move along.
Great, thanks, Zach. Really exciting to be here and to talk to folks about the American Rescue Plan. It's a new law that was passed in March and is really changing the way we think about health insurance and the cost of health insurance in Vermont. You know, when we look at the Vermont Household Health Insurance Survey, it's shown that the majority of Vermonters who don't have insurance say that the cost of insurance is the primary reason they don't. And with this law that was passed by Congress in March, it gives a lot more financial help to a lot more people to lower their cost of health insurance. So in short, if you know someone who doesn't have health insurance, and maybe they've looked at Vermont Health Connect in the past, looked at the plan comparison tool and just saw the costs were too expensive, it's important that we tell them that it's time to check again. It's a whole new world now, and we'll get into that. That's the point in short. The larger point is that once you decide and once you see you can afford a health insurance plan, you see there's a lot of options in which direction to go, and you can certainly save the most money. You can save some money by doing a few minutes of research on the plan comparison tool. You can be most likely to get a plan that meets your health needs and is best for your for your wallet if you do a little more research. And that's why we're really grateful that all three issuers are here today to talk about the health plans and the dental plan options. We thought to get warmed up, we have the slide, if I should show Zach the, we thought we'd start with just a four question quiz to get warmed up. Does that sound a right way to go, Zach?
That sounds great. I just put question number 1 up on the screen.
All right, perfect. Thank you. Yeah, so the question here is, we're wondering how much money an individual can earn in 2021 and still qualify for the tax credits to lower the cost of the health insurance they buy through Vermont Health Connect. In order to get financial help, you can enroll in a health plan through Blue Cross and Blue Shield of Vermont or MVP Healthcare, but you have to enroll through Vermont Health Connect. And then you receive these tax credits. You can either take at the end of the year when you file your taxes, or you can take them each month as a discount on your monthly bill, your monthly premium. And so we have the options up here, 5 options. If everyone's picked one, we'll go through. Sorry, we're not interactive, but in your own room can call out. Wonder how many people thought it was 31,492. That good guess. That's actually incorrect. 31,492 is the median income for an individual in Vermont. If anyone guessed $51,040, you would have been right if we'd asked this question about 6 months ago. That's what the threshold was before this new law was passed. If you were an individual earned up to $51,000, you'd qualify for lower costs. If you earned more, you wouldn't. But that's changed, as we referenced. Whoever guessed 61,973, that's also incorrect. That's actually the median household income. So the typical individual in Vermont earns about $31,000. The typical household earns about $61,000. But if you guessed $94,500, that's correct. An individual, one-person household earning up to $94,000 will qualify for tax credits and lower insurance with their Blue Cross or MVP plan, as long as they're enrolled through Vermont Health Connect or transfer their direct enrolled plan over to Vermont Health Connect. If anyone guessed $265,000, that seemed like a lot. That one wasn't right, but actually it is a relevant number. If this person we were talking about, if this hypothetical wasn't an individual, if it was a family of 3 or 4, and anyone in a family plan as opposed to an individual plan, they could be earning over $250,000 and still qualify for some tax credits to lower the cost of what they've been paying. So when we say that the American Rescue Plan lowers costs for a lot more people, this is what we're talking about. Everyone's ready for the next question. We're then talking about, so we know a lot more people are qualifying for help and qualifying for lower costs, but how much less are they qualifying for? And the good news is it's no longer a cliff. It's a phase out. So people right at that $94,000 threshold, or a family at that $265,000 threshold, they'd only be getting a few dollars off. But on average, for all those people who were earning more than the old threshold for that individual, that $51,000, or threshold for a family of 4 used to be about $100,000. So for people earning more than that, who are now getting tax credits and have contacted Vermont Health Connect to apply them as a discount to their bill, what's the average amount that they're paying less each month? $100, $280, $430 are the options. If everyone's thought of the answer, we'll go through again. If you're at 100, sorry. You said 280, we're sorry. So it's $430 less. That the average person who previously was earning too much money to get any financial help at all, they're now paying $430 less on their bill each month. So you're talking about coming through now, last 5 months of the year, saving a couple $1,000s if you're in that boat. Also for 2022 will be a similar amount. you're talking about saving a few $1,000s next year as well, really makes sense to sign up through Vermont Health Connect, or if you have a direct enroll plan, to call. If you do it by the end of the week, can get enrolled as of August, which is August is next week. So this is a good time to act.
So Sean, these are the individuals who are earning more than 51,000, or the families of 4 earning more than 100,000.
Yeah, that's exactly right. Yep. So the people who are earning less than that already would have been receiving some financial help in the past, and they're receiving even more financial help now. But this is just for people who weren't getting any help a few months ago, and now they're getting a significant amount, as you can see.
Got it. Thanks.
And the third question we have is wondering how much a couple can earn and still qualify for a plan with a $0 monthly premium.
And the premium is what people actually pay each month to keep their insurance. It would be their monthly bill.
Yep. Yeah, that's exactly right, Zach. So when we talk about the cost of health insurance, there's really 2 components. There's your monthly premium, that's the bill, like you say, that you pay each month to have that insurance. That covers things like preventive care and helps contribute to the costs of your coverage if you need to use your covered services. And then the second cost is your out-of-pocket costs, or your cost sharing. And so there's different plans that have lower premiums and higher out-of-pocket costs. If you need to use coverage, those tend to be better for healthier people. You have other plans that have a higher monthly bill and lower out-of-pocket costs. Those tend to be better for people who are more risk averse or not as healthy or need to see the doctor more or have conditions. But just for people, as we're talking about, most uninsured Vermonters say they don't have a plan because of cost. It's important to note that now with the American Rescue Plan, a lot of people can get a plan with no monthly premium. It'll certainly have higher out-of-pocket costs than some of the other options if you want to consider all your options. But that just at that level, if you're between those 2 choices of do I not have any insurance at all, or do I do I get a plan that has a low premium, it's important to see we're talking about a significant number of people who can get a plan with 0 premium. If you guessed 38,280, there's a couple you wouldn't be right. That number is actually significant, though. If you were just an individual, in an individual plan, not in a couple plan, you could have an income up $38,000, still find plans out there that are zero premium. If you guessed $51,720, you're correct. So if you're a couple earning $50,000 or even a bit more, there's plans out there that will cost you nothing each month. And the third option, the $61,973, you might have recognized that number if you're paying close attention. That was the number we had said before in the last question. That's the median household income in Vermont. So that typical household in Vermont, they can't get a 0 premium plan, but they're not a lot over that. And just for comparison purposes, a household that is at that typical household income, that nearly $62,000 level, they could find plans with premiums as low as $31 per month, which is a big difference. Just a couple months ago, the lowest plans they could find would be $152 per month, and the full price of that lowest cost plan would be about $982 per month. So even before the American Rescue Plan, they would have been receiving over $800 in financial help. But now with the additional help, their costs could be lowered all the way down to $31 per month. So it's a big deal. And just one last question to throw for folks. I know we mentioned here we've talked a lot about the special benefits that are available to people who are getting unemployment compensation. And so just to take a hypothetical, a Vermont family that's earning $150,000 per year, but they don't have health insurance through their through their job or an offer. And as long as one member of the household was eligible for pandemic unemployment assistance at any point, let's say in January of this year, asking how much money would they have to pay to get a health plan that would have a $0 monthly premium, and meant to put on here not just a $0 monthly premium, but meant to say a $0 $0 deductible is what I meant to say. So the options, mistyped there, the options below are how much they have to pay as the monthly bill, and the question there should read how much they have to pay for a health plan with a $0 deductible.
So this is a hypothetical, Sean, that uses the pandemic unemployment assistance, but really eligibility for any form of unemployment insurance through the Department of Labor would qualify you for this benefit.
Yeah, that's exactly right. So the traditional unemployment insurance or the pandemic unemployment compensation, the pandemic unemployment assistance, which was for people who maybe are self-employed or don't qualify for traditional unemployment insurance, eligibility for any of those programs through Vermont Department of Labor will qualify you for this special benefit. And this is one, the correct answer was right off. So actually I gave away the answer in the question there with my mistyping, because it's both a $0 monthly premium to get what we call enhanced silver plans, enhanced silver 94 plans, which are actually better than platinum plans in the sense that they have lower out-of-pocket costs. So anybody, whether you have unemployment compensation or not, if you're using the plan comparison tool and you see that you qualify for an enhanced silver 94 plan or an enhanced silver 87 plan, you'll see your eyes should go right to looking at those silver plans, because you're going to have lower out-of-pocket costs in that silver plan, either with Blue Cross or with MVP, than you would in a gold or platinum plan. And just for reference sake, a family earning $150,000, as we talked about, earning less than $250,000, you'll still be getting some financial help. This family, even without the unemployment assistance bonus, they could get a platinum plan for $1,400 per month, which is a lot, but that full cost, the lowest cost platinum plan is over $2,200 per month for a family, for the family plan. And so when you look at that, that value of that health insurance, that benefit that people would be getting, that they're now getting with the health with the health insurance assistance, and that extra benefit for for having unemployment compensation, it's really really important to check out and jump on that. And I think one last thing was just going to show we have here, if it's up, is just the 3 quick links. We won't get into them, but just for people that have gone to vermonthealthconnect.gov. I don't know if it's still displaying, Zach. But up when you look on the vermonthealthconnect.gov homepage, you'll see a plan comparison tool, the icon of a shopping cart, and that if you click on that, you'll be able to go through. In case these examples in this quiz we shown didn't resonate with you, you could type in your own information, see how much financial help you and your family would qualify for, and what plans would cost. You'll also see at vermonthealthconnect.gov, there's a link right at the top, learn how the American Rescue Plan Act lowers health insurance costs for Vermonters. That can give you a whole lot more information as well. And finally, when you're ready to sign up, there's a few ways to do it. If you don't have insurance, you can sign up through this special enrollment period anytime between now and October 1st for 2021 coverage. Like we said, if you sign up this week, they'll start the 1st of August. You can do that by phone. The phone number's up there on the site. Also through assisters that are in each county. Zach, you know a lot more about assisters than me, but people can find that information up there. And then I think, as we mentioned, really, the plan comparison tool gives a lot of initial research, some numbers to look at, but really once you want to make that decision of which plan, to see what doctors, what networks are covered, what different benefits are, which different types of plans are, it's really helpful to hear from the insurance issuers, and that's why I think we want to pass the baton back. We're really grateful they're here with us today to talk about them.
Yeah, thanks, Sean. And yeah, couldn't agree with you more. I think some great tools that we have going on with the plan comparison tool, and definitely the get help options. The link on the website. The assisters are available all around the state. Likely, if you kind of go to your local health center or hospital, there may be an assister there who can help you. If you have trouble locating one, you can call our customer support center, and they can help you find an assister near you, and that you could go see or work with virtually. We also have our assister directory online on our website, so you can go to our assister directory to find an assister to get this help. And then, like you mentioned, Sean, I think you mentioned the call center that's open every day, 8 to 4:30, with agents available to talk through enrollment and changing your plan. So, but yes, when you have more questions about the details of your plans, sometimes we need that extra support from the carriers. So I am going to ask our carriers who are with us now to introduce themselves. So first up, we are going to speak with MVP, a representative from MVP. So I think Kelsey is here from MVP, and I'm going to put Kelsey's slide up on the screen, and she will introduce you to MVP. Kelsey, if you can just make your slide kind of in the share, the view slide mode, the presentation mode. Should be at the bottom right-hand side of your screen. I think there's a little presenter icon there. Perfect. And I don't know if you have your camera ready, Kelsey, to go, but perfect. Here we go. All right. So thank you, Kelsey, for joining us.
Thank you. Hi, everyone. My name is Kelsey Thornton. I'm a representative here today from MVP Healthcare, and I'm here just to give a brief introduction of MVP and some of our plan offerings. So I'll just get started here. Now more than ever, MVP Healthcare has you covered with savings, quality, and peace of mind. And some of our plan offerings include a $600 well-being rewards program where members with MVP Vermont Plus non-standard plans can actually earn up to $600 per contract per calendar year for taking part in healthy activities, living healthy lifestyles, and just meeting their health goals. All of our 2021 plans include a $0 GIA virtual care service. GIA is a new program, and it is a connection to MVP's free virtual healthcare services that are available 24/7 through phone, web, or via the mobile app. And GIA is a program that can assess your health needs and quickly refer you to the right care for your current condition. MVP also offers affordable prescription coverage where members can choose from a vast selection of participating pharmacies and save up to 20% off on CVS pharmacy brand health-related items. We also offer a $0 generic prescription for children 10 years of age and below on select plans. We have $0 preventive care services, which include annual physicals, vaccinations, and other screenings that are recommended by age and gender guidelines. And our network strength, MVP members have access to top doctors in Vermont and also nationwide. And we have an online tool where you can find our participating providers or facilities near you, and that can be found at mvphealthcare.com/find-a-doctor. And if you have any questions or comments, a need to compare plans, you can visit mvphealthcare.com/Vermont or call our customer care department, which can help make the most of your coverage. And that number is actually 1-800-TALK-MVP. And that, I believe, is all from me. If you have any questions later on, we can definitely help answer them if if you have any questions about our plan or MVP offerings.
Thank you, Kelsey. Appreciate the overview. And Kelsey will be with us throughout the rest of the town hall, as well as one of her colleagues if questions come up specific to MVP. So next up, we have Blue Cross Blue Shield. Cindy from Blue Cross Blue Shield will be presenting, I believe. And Cindy, if you want to share your content with me now. I also while Cindy is getting that content up and running, I do want to mention that we do have a couple questions in the Q&A. Those will be answered and will be addressed as soon as we're done introducing the carriers. So without further ado, let me send Cindy up to the screen, and welcome, Cindy.
Thank you very much. My name is Cindy Blanchette, and I am a manager at Blue Cross and Blue Shield of Vermont. And today I just want to touch base on a couple of the highlights for Blue Cross and Blue Shield of Vermont as being the only local not-for-profit health plan in Vermont. And when we think about Blue Cross, we think about products and services that are made for Vermonters by all Vermonters. And my screen won't advance. I want to also touch base on just a couple of our, kind of categories of our plans that we have. The first one I want to talk about is our Vermont Preferred plans. This has a couple of very unique benefits associated with it. Included in this is what we call our 369 plan. So what that means is that you can have services without a copay from your primary care physician, a mental health counselor, or a substance abuse provider at no cost. In addition, this preferred plan also has a special benefit available for those people that may have diabetes or heart disease. What this does is allow an additional three office visits per year of specialists such as cardiologists, endocrinologists, nephrologists, ophthalmologist, or podiatrist, and again, that's at no cost. We also have what we call the Vermont Select plans. These plans offer great value in terms of the deductibles and are compatible with health savings account. And finally, we have our standard exchange plans, and there are a range of deductible plans that you can also pair with your health savings account. When we talk about healthcare for Blue Cross and Blue Shield of Vermont, we talk about health plan with access to high quality care and a range of benefits. As with preventive services are certainly covered at no cost to you, and include all of the appropriate health screenings by age. We also have 24/7 telemedicine benefits available. And we offer a health and wellness resource that will help you set your goals and track your progress. Nationally, we have over 96% of our hospitals that are in Vermont and nationwide. And included in that are 93% of our healthcare providers are also in this nationwide service area. So when you choose Blue Cross, you receive coverage from a trusted Vermont organization. And going along with that, we're always really proud of our award-winning customer service model that we have in place. What I want to leave you with is the thought about this, and that is we are here to support you. We're here to help guide you through the process. And even though you may need to go through VHC to enroll to change your plan, give us a call, visit our website, let us help you navigate the plans and help you decide which product offering best suits your family's healthcare needs. So you can visit our website at bluecrossandblueshieldofvermont.com/QHP or give one of our licensed consultants a call at 1-800-255-4550. And certainly feel free to email us anytime at consumersupport@bluecrossandblueshieldofvermont.
Thank you, Cindy. And Cindy also will be joining us for the remainder of the town hall, along with one of her colleagues for questions as they come. Okay, so last but not least, we have Northeast Delta Dental with us. They are the dental plan offering. I am going to put Kathy up on the screen, who is our representative from Northeast Delta Dental. And I'm just going to wait until Kathy's all set here. Kathy, if you can just do your kind of display in full screen mode, we will be good to go.
I think does Cindy need to stop sharing too?
I'm having difficulties here. Couple
yeah,
technical difficulties.
Yeah, Cindy, there should be an X up in the upper right, just to the left of the leave, the red leave button. There should.
Of course. Okay, so my computer's not responding. I'm sorry.
Okay, so Kathy, can you try sharing one more time, and see if that doesn't work, we might have you just voice over the website.
I tried. Can you see my screen now, Zach?
Yes.
All right.
Perfect. Okay, great. Thank you everyone for bearing with us, and take it away, Kathy.
Very good. Well, I am Kathy Frankel. I'm the customer service manager for Northeast Delta Dental. I've been here for 21 years. Northeast Delta Dental, as you probably know, has about 55% of all the insured dental plans in the state of Vermont. We have been covering the state of Vermont for the last 60 years. We do have a independent plan. So if you see here, here's our web page. And if you click on the outline of coverage, you can actually go into the information. Oh, let me see if it'll let me in. There we go. There we go. So when we click the outline of benefits, you can see all the details that go along with the independent Northeast Delta Dental plan that is offered through Vermont Health Connect. A lot of good information here. As always, you can always reach us by phone at Northeast Delta Dental by calling 1-800-832-5700. We have that also. And we are looking forward to 2022, where Northeast Delta Dental will be helping with the premium payments. So our customers from Vermont Health Connect will have a sign-in where they can go in and look at their original documents, in addition to doing that through Vermont Health Connect also. So we usually see an uptick, of course, in enrollments in the fall months, October, November, and December. I believe November 1st is when enrollment will start for the new year, as well as what they allow for enrollment to go through right now. So we enjoy working with our Vermonters and the Vermont Health Connect Northeast Delta Dental plans. And of course, if you have any questions, the Q&A is here, or certainly give us a call at 1-800-832-5700 and we can answer any questions you may have about the Vermont Health Connect plan. Thank you.
Thank you, Kathy. Great. So thank you all carriers, and that went relatively seamlessly for one of our first live events here in doing these town hall meetings. So thank you all for bearing with us, both our presenters and our attendees. We're going to move now to the question and answer segment of our town hall. So I'm going to bring Sean Sheehan back up onto the screen here. And I will read one of our first questions. And what the format will be is that Sean will answer best he can, and if need be, defer out to our carriers who have stayed on the line with us. So let's go to the first question. This question says, my spouse is insured by her employer. I cannot be on her plan. I am self-employed with no health insurance since 2013 because plans became unaffordable under Obamacare, and am only eligible for an $81 subsidy as a married person with an employed spouse. But if both of us were uninsured, the subsidy would be $751. Why is there such a discrepancy between only one of us needing insurance and both of us needing it? So Sean, that was a lot of information, and I can try and repeat any of it if need be, but
Yep. Yeah, no, I got it. It's yeah, it's a great question, and it's one of the pieces that unfortunately the American Rescue Plan didn't fix completely. And what it's sometimes known as, the situation here, I think, is a little bit different than what is often referred to as the family glitch. And what the family glitch refers to is that the way the Affordable Care Act set up the test for affordability and the way the subsidies are calculated is based on a household income compared to what it would cost an individual to pay as first the litmus test as far as whether you qualify for that coverage. So having that discrepancy between what an individual plan would cost if you were to buy it through the employer, and what the household's income is, not the individual's income, is a discrepancy, and means that people who are paying for plan through employer may have to pay a lot more. Now, this is a little bit different than what Kate asks, in the sense, because Kate says that she can't be on the spouse's plan, and that's actually maybe a good thing, in the sense that if the spouse's employer did offer for the spouses to be on the insurance, the other family members to be on the insurance, but made them pay full cost, they'd be completely out of luck and not eligible for any subsidy. And that wasn't corrected by the American Rescue Plan. There is talk, we've heard, we know the Vermont's congressional delegation is pushing for that to change in Congress, and we've heard from our federal partners that there's work to address that glitch happening, but nothing firm yet. The other piece of it where it relates here is, so in Kate's case, fortunately, she's not offered the health insurance through the spouse's employer at full cost, so she doesn't have an offer of health insurance. Because she doesn't have an offer of health insurance, she can come through Vermont Health Connect and qualify for subsidies. But again, it's going to be based on a maximum amount that a certain benchmark plan, which happens to be the second lowest cost silver plan, is the benchmark plan that subsidies are calculated off of. That plan has to be below a certain percentage. People with high incomes can't pay more than 8.5% of their household income for that plan. If they choose a bronze plan or a different plan, they'll be paying less than that 8.5%. If they have a lower income, that cap could be as low as 0%. And so really, I know I'm throwing a lot of numbers that way. I know it is complicated. I think the best thing to do is to look at the plan comparison tool, and which you can get to at vermonthealthconnect.gov to see this particular situation. And I think, obviously we don't see Kate's income here. We don't want people to share income or personal information in this forum. But those are the kinds of things, if you call the call center or look at the plan comparison tool, can get information about that situation. And so the reason is, to Kate's other part of the question, is that if the spouse didn't get insurance through the employer, then they would together be going to look for a couple plan, a two-person plan through the exchange. The way the federal law is set up is they would still be capped at paying 8.5% of their income for that plan, even though it would be a two-person plan as opposed to a one-person plan. The full price of that plan would cost twice as much as the one-person plan, but the dollars that they would have to pay would be set. It would be fixed, and that's why the subsidy would make up the difference. That's why they would get $750 of subsidy instead of the $81. So yeah, there's definitely pieces in there that might not seem fair. I'd say most people could agree aren't fair, aren't ideal. I think even the unemployment compensation piece is one you can look at and say, oh wow, that scenario I had, somebody making $150,000 or $500,000 could get one of these plans with just about no out-of-pocket costs and and no premium. That doesn't seem fair compared to other people, and I think it's a lot of different benefits that were loaded in here to try to help people out during the public health emergency. And when you compare them side by side, they don't always add up, but there is a lot of help, and there's a lot more help than there was a few months ago.
Thanks, Sean. And that, I think, just to kind of reiterate, I know one of the things that we tell folks a lot is if there's any questions, we have our eligibility experts and staff who can answer your questions, and our assisters who are also trained to help navigate these more complex situations. I mean, health insurance can be complex without an additional kind of complexity within your your family situation or your household situation. So totally understandable, very common for people to want that extra guidance and support. So just moving on, we've got a few more questions. The next question is, how long will the ARPA, that's the American Rescue Plan Act rate, be in place? Is it through 2022? So Sean,
yeah, I apologize, was on the mic there. Yeah, so that's a great question. American Rescue Plan actually had three key provisions that relates that together form the benefits we're talking about here. Two of those three are good throughout the end of 2022. The third benefit, the one we've talked about with the unemployment compensation, people that have gotten any unemployment insurance in 2021, having that opportunity for zero premium plans, very low out-of-pocket costs, that's only good for the rest of 2021. But the other provisions, namely expanding the eligibility threshold that we talked about, so those individuals who used to be capped at an income of $51,000 now being able to earn up to about $95,000, or a family which depending on the size of the family, it might have been about $100,000 of income was the cap, now being $250,000. That provision is good throughout the end of 2022. And there's also a push in Congress to make it permanent. And the second provision, the one that lowers the percentage that people have to pay, effectively increasing the amount of their tax credit and lowering what they pay for their premium for any metal level plan they choose. That provision is also good for the end of 2022. So what that means is that most people, actually, in looking at proposed rates, the 2022 rates will be finalized by the Green Mountain Care Board at the end of next month, likely. And we'll have firmer numbers then in a plan comparison tool. But it means that for the vast majority of plans, people will actually be paying less in 2022 than they did in 2021. So at least for the next year and a half, these benefits are in place.
Thanks, Sean. I know that's been a question, a pretty common question. It's a great question. So next up, we've got a couple questions about dental. So I'm actually going to pair them together. And Sean, you may take these, or you may want to defer to Kathy on these. I don't know. You let me know. But the first question is there an ARPA, again, that's the American Rescue Plan Act, related discount for the dental plan? And the second question is Delta Dental providing service starting now or only in the new enrollment period?
Okay, great. Yeah, I'm happy to pass that to Kathy. Question the details of it. I will say for the first part of that, no, the American Rescue Plan and actually the Affordable Care Act as well don't give subsidies for dental, just for the health plans. But recognizing that it helps people to be able to sign up for health plans and dental plans in one place is the reason why we make the dental plans available to be purchased through Vermont Health Connect, and the reason why we're having Delta Dental here to answer the questions. And Kathy, happy to pass the baton to you for the rest of the question. Any comments you want to add?
Hi, thanks, Sean and Zach. Yeah, thank you for clarifying that the American Rescue Plan is not really designated for dental, but as you said, certainly if people get a nice benefit of that for their health plan, they may have the dollars available for the independent Delta plan that goes along with that. And what was the second half of that question, Zach?
Yeah, so the first half was how long will is there a discount through ARPA? And the second part is Delta Dental providing service starting now or only in the new enrollment period?
Well, Delta Dental is providing service now. I mean, it's been ongoing. Of course, enrollment is all through Vermont Health Connect. So the citizens in Vermont need to go to Vermont Health Connect first and qualify to enroll for both their health plan and their dental plan and work through it that way. So, yeah.
And so with the special enrollment period, being open now outside of the open enrollment period due to COVID and the pandemic, as we mentioned, people being able to sign up through October 1st, whereas normally you wouldn't be able to this time of year unless you had a particular life event for the health plans. What you're saying is, Kathy, it's the same thing, right? Managed through Vermont Health Connect. People can use that period to sign up for their dental plans as well, as long as they meet the residency requirements and other requirements.
Right, exactly. Thanks.
Thank you. Your turn to be muted, Zach.
Thank you, Sean. Okay, we have another question. Will the state fine individual mandate be in play for the 2021 tax year for the uninsured? So I'm going to put that to Sean.
Yes, so the state's individual mandate, my understanding of it is that it's in place. You're required to have insurance and to report on it. But there isn't currently a fine attached to it. So right, so to that extent, that's, yeah, the laws that you have health insurance. There is a reporting requirement with the state taxes, which will be on the state tax forms, but there's not a fine associated with it.
Thanks, Sean. I'm wondering if you can touch on a little bit on why someone, there's this unique opportunity. Normally folks can't change plans mid-year, and I think you touched on this a little bit in your introduction, but I'm wondering if you can just kind of speak a little bit more about why someone might want to look again and maybe both the financial end of it and just the kind of plan option end of it, because I understand while it may be straightforward for some, this is kind of a unique opportunity and a little bit confusing for others why they would change mid-year.
Yeah, absolutely. Thanks, Zach. That's a great question. And I think where it comes down to is we touched upon a little bit earlier as far as there being the two components of what people pay for their health plans. There's the monthly premium, that's the bill you pay each month to have your health insurance. By paying that, all your preventive services are covered, and you also have access to all 10 of the essential health benefits, the ambulance services, the emergency care, the inpatient. But how you pay for all of those services outside of the preventive care is different depending on which plan you're in and which metal level you're in. Metal levels go bronze to silver, gold, platinum. We talked a little bit about for people who have unemployment compensation and people whose income is less than twice the federal poverty level. So an individual earning up to about $25,000 or a family of four earning up to about $50,000. For those folks, going into an enhanced silver plan is going to be better than a gold or platinum plan. There really would be no reason if you're in one of those cohorts to be in a gold or platinum plan. But for people who have higher incomes, they may want to go in a gold or platinum plan. What a gold or platinum plan will give you is the same benefits. No, covered services aren't any different, but you'll be paying a higher monthly premium in return for lower out-of-pocket costs when you use services. On the flip side, a bronze plan is going to have the lowest premium, but it's going to have higher out-of-pocket costs. And what we'd found in the past is that for people who were maybe at around those income levels, maybe an individual earning about $25,000, they could get a bronze plan for zero premium, and so, or they could pay maybe $100 a month and have a silver premium, so have a silver plan, enhanced silver plan with very low out-of-pocket costs. And granted, that would be a big discount of the full price of that plan, but still, for someone at some of those income levels, $100 a month, could be a lot of money. They might need that for other things. That maybe they chose that $0 bronze plan and took a risk on higher out-of-pocket costs if they got sick or had an accident. And what you're finding now with the American Rescue Plan, meaning that same individual could get a silver plan for $0 a month or very close to $0 a month and have low out-of-pocket costs. Or if they have any income and they had any unemployment compensation, then they could get a $0 plan with a $0 premium for their enhanced silver plan. Those are the folks who it really makes the most sense for them to change out of that bronze plan and into a silver plan. I kind of liken it to the equivalent of if you had your cable bill and you were on your signed up for your cable plan, that you had your HBO or your films you had to pay extra for, and now you can get your same basic cable bill, but also get all of those movies streamed and everything for no additional cost. It's really it's a great, easy, should be an easy decision there for folks to move from bronze to silver. But beyond that, even people who have higher incomes, maybe they were in a silver plan, but now they had a high income, they weren't getting any subsidies. Now that they're getting subsidies, they could pay less for a gold plan than they would have for the silver. So a lot of options. Really, I think it's something that's important for people to look at the plan comparison tools about, talk to the insurance issuers, talk to Vermont Health Connect if they want. The one important distinction I want to really emphasize, though, for people as they think about changing their plans is that anything you've already paid toward your deductible, for those out-of-pocket costs you've already paid, anything you've paid will transfer to your new plan as long as you stay with the same issuer. So if you're already in a plan, either through Vermont Health Connect or direct enrolled with Blue Cross or MVP, vast majority of people, it's going to make sense to stay with your same issuer. If you're with Blue Cross, look at other Blue Cross plans, maybe they're silver plans or others. If you're with MVP, look to other MVP plans. And so that's something that I think really encourage people to to look at there.